Welcome to episode 4 on IVF Success Secret. Today we're looking at inside the IVF lab from stimulation to embryo creation. And with me today is Dr. Fache. Dr. Fache, you're welcome.
Thank you, Ramona. It's a great pleasure to be here once again.
Now let's walk through the actual IVF circle. What's the first step once a couple starts?
All right. So we've talked about IVF preparation, choosing the right clinic. We've explained what IVF it really is and who needs IVF. So the next step now is once a patient is ready and certified, ready to start IVF, the first step in the IVF process is what we call the stimulation. This stimulation is the stage where we give hormone injections to help the body to produce a lot of eggs as against the one egg that the ovary normally releases during the normal menstrual cycle. The aim of this is that we're going to be extracting the eggs eventually and mixing with sperm. Bringing this out, of course, would affect the output. So it's not a treatment. One would wonder if in the body you would just one egg starts this journey and completes it, and we're saying that okay, we have a control lab lab environment that simulates how the body works. Why can't we just extract one egg? That is not exactly so, because over time, in the beginning, that was what first IVF was harvesting that one egg. But today, we understand better that the higher the number of eggs you start with, the more likely is the IVF to succeed. So we start with stimulation, which is giving daily injection that may last between 10 to 12 days to help the ovaries to produce enough eggs so that these are extracted eventually for fertilization.
Is that same as hormone injections? Is that the same thing?
Yeah, you use hormone injections to achieve this stimulation. So we call it ovarian stimulation, like you are stimulating the ovary to produce more eggs instead of one.
So how is that tailored to an individual or each individual?
Yes, so this stimulation now, like we say, is one of the critical aspects of IVF because it's the starting point, and what happens during the stimulation will determine how many eggs you get will determine the likelihood of success. And so there are several injections that we can use for these processes. But basically what you're trying to achieve is one injection that halts the processes in the brain. So it's like you're trying to create an artificial cycle. So you want to stop, you want to interrupt that process in the brain that makes it like there's only one, that is telling the body to produce only one egg. So one of your injections is helping to stop the brain from that signal. And then you have the other injection, which is actually helping stimulating the follicles in the ovaries to mature so that they are eggs. So we have, at the end of the day, several mature follicles compared to one. And this is exactly the same reason, because of this injection that we give to halt the brain signal. That is why at the end of the day, when women get pregnant through IVF, we give them what we call luteal medication, because the brain has been conditioned to say, okay, do not secrete this hormone anymore. Yes.
Can you walk us through what happens during egg retrieval?
Okay. Yes. After stimulation, the next stage is egg retrieval, and this is usually when you get to the point where you have at least 3-4 leading follicles. Now, follicles are the things in the ovaries that contains the eggs. We can't actually see the egg physically. What we see are follicles, and then these follicles contain the egg. So when we have come to the end of stimulation, then the patient is taken to the IVF theater where the follicles are aspirated via ultrasound guidance. So
Could you break that down? What's aspirated, please?
okay, so the fluid in the follicles are taken out. That is aspiration, and then once that is done, we look for eggs in that fluid. It's like sucking out something, sucking out fluid from the follicles and then going to check the follicles, the fluid that you have extracted now, check whether the eggs are there. And so that's the process of egg collection or oocyte retrieval or oocyte pickup. Is usually done under sedation. It lasts typically for between 15 to 30 minutes. And it's a day procedure. Patients who have it, there's no surgery. It's just that ultrasound guidance needle is introduced into the follicles one by one, and the fluid is aspirated. So that's basically what egg retrieval means.
How about ICSI? What is that? And then how is that different from the traditional IVF?
Okay, so after the eggs are retrieved, the next natural stage is bringing the eggs and the sperm together. And so this can be done in the traditional way, what we call insemination. Insemination is basically like you are mixing the egg and the sperm in the same dish in the lab and then allowing natural selection. The eggs and sperm should just fertilize each other. So that is what insemination is. ICSI now stands for Intracytoplasmic Sperm Injection. Intracytoplasm, that is inside the cytoplasm of the egg. That is where you are injecting. So it is a process that entails picking individual sperm and injecting into the egg. This is usually done for men who have low sperm count, poor morphology, poor motility. The aim is to increase the chance of success of fertilization. It can also be done in other situations, but that semen abnormality, when you have a frozen semen, even if it's normal, most of the time you end up having to do ICSI. There are times we're looking to sort out sperm for certain purposes, maybe gender balancing, you might end up doing ICSI. So, but basically, the difference is instead of just mixing sperm and egg, you are picking individual sperm cells and injecting them directly into the eggs. Yeah, so it helps to improve the chance of fertilization of the eggs by the sperm.
So in the case of IVF, you just mix. In the case of ICSI, you pick.
No, IVF is the general terminology of everything that we're discussing. And so, it's important to make this distinction that ICSI is not a different kind of fertility treatment. ICSI is just a part of the IVF process where instead, we said first you start with stimulation, which leads you on to creating, developing plenty eggs, which you eventually take out during the egg collection process. And the next stage now is to fertilize the eggs that you have collected. How do you fertilize this egg? You can either do insemination, which is, okay, everything is fine. I bring my container, I put the egg and the sperm inside, and then by the next day, for instance, I am checking to see how many of the eggs have accepted the sperm. This is usually the practice most places where the semen is of normal parameter. But where we have challenges, then we do ICSI. So ICSI is just a form of fertilizing the egg. It is not a different kind of of IVF. It is part of IVF, which is used to help to inseminate the eggs and encourage fertilization.
So what happens in the lab after fertilization, and how do embryos develop?
Okay, so once fertilization have occurred and the embryologists have confirmed that fertilization has occurred, this embryo is formed. So from egg, fertilized egg, then becomes embryo. So these embryos are cultured in the lab over the next 3 to 5 days. to follow up on their development. And so the embryologists can keep checking on the embryos to see how they are developing. So this can be done manually, or it can be done with advanced equipment like what we call the time-lapse machine, which enables you to real time, you're able to see how the embryo is developing. By and large, it helps at the end of the day to see how these embryos are developing, and it helps in grading the embryos at the end of the day. If we have most times the aim is to culture these embryos for 5 days so that they get to the stage that we call the blastocyst. However, there are instances, maybe because of few number of eggs that were retrieved, or because the development is not looking okay. Sometimes we have had to transfer on the 3rd day, which is like the cleavage stage of embryo development.
So what's embryo grading, and why is it important?
Grading is what the embryologists do to be able to look at the pattern of development of this embryo, and then the cell division. As embryos are dividing from 2 to 4 to 8 to 16 to 32, you're looking at how much time do they take to divide. Are they dividing well? So at the end of the day, you can have blastocysts and you say, okay, this one is A grade, this is B grade, this is C grade. They are all blastocysts, but somehow, by their structure, the embryologist is able to know that, okay, this looks better than this. And so higher grade embryos tend to do better than lower grade embryos. But by and large, sometimes it doesn't follow exactly, because there's also some subjectivity in the grading of this embryo. But that is what we have at this time to be able to say, okay, do we have good embryos? What are their grades, so that it would help us in choosing the right embryo to transfer?
Now, you mentioned something earlier about 3rd day and then 5th day. How do clinics decide between day 3 and day 5?
Embryo on day 5 usually is called the blastocyst stage. Evidence and research have shown that such embryos tend to do better than the cleavage stage embryos. These are advancements in the IVF treatment, progress, where in the beginning most embryos were transferred on day 2, day 3, because there were no equipment to be able to keep embryos outside of the body in the lab for longer. Over time, it became possible to extend the length of time that these embryos can be cultured outside of the body. And so most of the time, most clinics would aim to do a day 5 transfer. But like I said earlier, there may be some constraints. You have few eggs, and then you know that, okay, few embryos, and there's a likelihood that if you want to wait till day 5, these embryos may not make it to day 5. So you might therefore think that if you return them back on day 3, they might probably do better in the natural environment than keeping them in the lab, because we've come to realize that no matter how much you try to simulate the body in the lab, it's never the same. And so that's one of the thinking, that instead of waiting until day 5 and have nothing to transfer, why don't you return them back? So most of the time these days, the decision to do day 3 transfer is not a deliberate one. It's usually conditional, that, okay, you have a situation, the aim is to do day 5 transfer, but you have situation that makes that unlikely, and so you decide, okay, instead of nothing, let us do day 3 transfer. So most modern clinics would want to do day 5 transfer, which is the blastocyst stage transfer.
Thank you again, Dr. Fache, for your great insights today. Today, we looked at embryo grading. We also looked at culturing embryos. On our next episode, we'll be looking at embryo transfer, the most critical moment. Join us next time. Thank you for watching.